All right, guys, sorry I'm late. We had a malfunction with my wife's phone, but we got it resolved. Yay! Let's see if the applause button will work. Here we go. I am the man. I am the man. I am the man. All right, we have a great show today. I know we're late, but we're going to do our Poop Scoop Monday. I want to thank you for joining me today. Usually, we go live at 7 o'clock p.m. Central Standard Time. I know we're late. It's okay. It happens. Life happens. We have a great show today. So every Monday, I go live to answer your questions, to have office hours to answer your questions you guys may have, and to go deep dive into a topic. If you have a question for me today, don't forget to post it on the comments so I can answer those questions as well. And we have a couple of things we're going to talk about. We'll discuss, and go through my list here. I apologize. We will discuss the common myths that I hear about your gut, and I will debunk, yes, some of those myths that I hear about. We will also talk about the importance of exercising for promoting your gut health. If you're wondering why you're not going or you're having gut issues, maybe it's exercise, that's the key. And we'll talk about natural options when it comes to diarrhea, and we'll answer your questions live you guys have as well. So joining for the first time, I'm Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I work in Lubbock, Texas, Lubbock Gastro. Come see us for all your GI needs. Let me know in the comments if you're watching this live or on the replay, and where you guys are watching this where you guys are watching at so far. So rate us so far. Idaho looks like you're the big winner so far of where you guys are watching this at. All right. So, without further ado, let's go ahead and talk about some of the most common myths that I see. So, as a GI doctor, I see a lot of things on social media, and a lot of patients ask me questions all the time about some common things they've seen on social media. In fact, I have a lot of videos about this particular topic. So I'm going to go through the 3 most common myths that I hear about on social media. Let me know in the comments down below if you've heard these same myths, or if you have a myth you want me to debunk that you heard about as well. I'd love to hear that because I love debunking myths. And let me know in the comments as well if you want me to do a full series or a couple of series about me debunking the most common myths or the most common things that people hear about or read about when it comes to their gut health. All right, myth number 1, probiotics are necessary for your gut health. Let me know in the comments down below if you've heard that, if you've been told, hey, you must be on a probiotic to improve your gut health. Well, let me tell you, it is a myth. Probiotics do work for some individuals. Now, probiotics are added bacteria that you can add on to your gut either by foods or supplement to improve what is already going on inside your GI tract. And for some individuals, not everyone, it can improve your gut health, get you feeling better, maybe get you more regulated, help to minimize some bloating. In fact, I had a patient come to me today who said, hey, Dr. Islam, I feel fine, I feel great, but I was told I need to be on the probiotic. And guess what my response was? No, you don't. Not everyone needs to be on a probiotic. So, do you feel okay? If your gut's doing fine, you're pooping normally, you don't have any issues, guess what? Don't worry about being on a probiotic. Number 2, are you doing the right things correctly? So a probiotic is a supplement. It is not a treatment, meaning you cannot probiotic your way to health. You have to have the right diet, the right exercise, manage your stress. Sometimes even medical therapy can help out. Now, you can add a probiotic on top of that, and that's fine, but don't think this is a substitution for what's feeling better and what's going on. And number 3, if you don't want to take a probiotic, don't do it. There's nothing that's making you. I'm not making you. And you certainly should not be pressured to try and take a probiotic. Now, there are some probiotics that are out there that can help out with some individuals. Let me know in the comments down below if you want me to do a video on this, which I'm more than happy to give you my recommendations on probiotics that I recommend as the Poop Guru. Let me know in the comments down below if you want me to do a future long form video on this. This is myth number 1. Myth number 2, you need to detox your gut regularly. No, absolutely not. Detoxing your gut is a complete myth. In fact, people who tell you that you need to routinely detox your gut have no idea what they are talking about. Listen, if you have a colon, if you have kidneys, you are automatically detoxing your gut. If you have a liver, guess what? That is what your liver does. Do not get tricked into taking these detox supplements to get you feeling better. Let me tell you a story about a patient of mine. I had a patient of mine that was taking a liver detox because she thought that taking this detox would get her liver cleaned out. She had no issues beforehand. Guess what happened? This patient actually went into liver failure because of her detox medication. Her detox medication caused her to toxify her liver to make things worse. I had to send her to get a liver transplant. It's the same thing with all these detox therapies that are out there. There's no evidence for them. They don't help, and they can make things worse. So if you have a working colon, if you have working kidneys, if you have a working liver, that's all you need. Do not get tricked in trying to detox your body with some pill or some supplement. You're gonna make things worse for you. It is not something I want you to do. Let me know in the comments down below if you've seen these detox things that are out there. And let me know, I'm kind of curious, what are people claiming that you need to detox from? Because basically, you don't need that. I can tell you as your poop guru. All right, myth number 3, gut health is only about digestion. Now, digestion absolutely is a big part when it comes to gut health. But guess what else is involved when it comes to your gut health? Your skin, your mood, brain fog, depression, joint issues, just feeling sluggish or tired. A lot of the diseases stem from what is going on inside your GI tract. What you eat is what you feel, and what you eat can manifest in certain diseases. And so, if we can get your gut microbiome taken care of, if we can get you feeling better, you'd be surprised how much better you're going to feel. I did a video this morning about my journey on my gut journey on what I did. And I noticed for me that when I grew up, I didn't have the greatest skin. I had acne, I had oily skin. It just wasn't a good sight. But when I started to take my health seriously, I ate better, had more plants, had more vegetables. Guess what improved? My skin improved. But not only that, my sleep got so much better. I was able to sleep fuller and last longer. And I know that sometimes when I cheat on my diet and I have some greasy foods or some meaty foods, guess what suffers? My skin, my reflux, and my sleep. And so gut health is more than what's going on in your digestion. It can affect pretty much everywhere in your body. And so I want you to realize, even if you have the optimal, you feel great with your gut, other things could be affected by what you're ingesting. So just realize that and try and see if you can make the change to improve your gut health to get you feeling better. These are the 3 most common problems I've seen, or myths. Please let me know in the comments down below. I would love to add more myths I can debunk. I love debunking myths. It's like my thing. I want to be a myth buster. That's exactly what I want to do. Let me know in the comments down below. All right, Jose, Odessa, there we go. It's where I'm from, my hometown. Wichita, thank you, watching. Thank you, Rochelle. Thank you for watching from there as well. Perfect. All right, sounds good. So we have a couple of questions. I'll go through this in just a little bit. So topic number two, the role of exercise when it comes to your gut health. Did you know that exercise is one of the foundations to improve your gut health? Absolutely it is. There are a couple ways that exercise can help us. So number 1, your body thrives on movement. It wants to get things going and flowing. And the less that you exercise, the more that you're sedentary, the more likely it's going to be for you to have gut issues when it comes to heartburn or reflux, because food just sits in your stomach. The worse your gastroparesis could be, which is delayed gastric emptying, and the worse it can be when it comes to your bowel habits. Constipation is related to not moving or not going around. Number 2 is that exercise can physically change your gut microbiome. You can physically have a change of what's going on inside your gut by exercising alone. We actually have seen evidence of athletes, when you compare their gut microbiome to those that are not athletes, it is remarkable the change. Those athletic gut microbiome, their GI tract is full of good bacteria that produce so many good ingredients for your body that improves other problems or other things going on. When you compare those to the gut microbiome of those that are not athletes, it is like a completely different story. It's all like sad bacteria and frumpy bacteria and not friendly bacteria. That's not good for you. So not only is exercise good for your gut microbiome, it actually can change what is going on a cellular level. But also number 3, keep in mind, exercise is incredibly important for your mental well-being. It is literally the cure for pretty much all diseases that are out there, whether it's depression, anxiety, stress, heart disease, colon disease. This is the best thing you can do, and it's free. And so not only will it improve your mental well-being, that improvement of how you do up here will manifest inside your GI tract. A lot of my patients are stressed by what's going on in the world, but also they're stressed by their gut. And their gut makes them stressed. They get more stress from their gut. It ends up being a vicious cycle. Exercise is one of the most effective ways to break up that cycle so you don't have any problems, or you can at least minimize those issues. So if you can do anything today to improve your overall health, just exercise, go for a walk, maybe go for a run, lift weights, do something, because your body will thank you. Let me know in the comments down below if you've incorporated exercise in your diet and what difference it's made for you. I know for me, I exercise every single day. I try to do something, and the days that I don't, I feel terrible, and I know that my body does as well. All right, if you're joining for the first time, my name is Dr. Islam. Yes, I am your Poop Guru. Every Monday I go live to answer your questions. I have office hours that I can answer your questions for you. If you haven't already, don't forget to smash that like button. We only got 3 likes, guys. Come on, let's get more. Smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter. Let me know if you're watching this live or on the replay. And also, come see Celeb Gastro for all your GI needs. I see a couple of questions on there. Don't worry. I'm going to get to those very, very quickly. In fact, let me see if I can get to a couple of them right now. Good, perfect. So let's talk about, Rochelle talks about a question that I want to talk about, which is, what do I do if I'm taking antibiotics and I'm trying to improve your gut microbiome? So it's a very common dilemma that people are in, because you have to take antibiotics for a lot of infections. Listen, I am pro antibiotics. I do not want to die from some sort of crazy or easy to treat bacterial infection. But the issue is that we are using antibiotics almost as water for every single condition. You know, antibiotics don't treat viral conditions, which is the vast majority of issues that people have. And so whenever you take an antibiotic, it can change your gut microbiome to the point where you have too many bad guys. You'll lead to chronic problems down the road. I see this all the time. Here are a couple things that I recommend. So number one, always remember that fiber is the foundation for gut health. So if we know we're going to change our gut microbiome by having antibiotics, see what you can do to add more fiber into your diet. The best fiber I recommend are prebiotic plants. These are the best ways to improve your GI tract and to improve your gut. But also add things like oats, wheat, Ezekiel bread, whole grains, nuts. These are fantastic sources of fiber that are healthy and good for you. So the first thing I recommend is to make sure you fiber up to get you feeling better. Number two, make sure you take the antibiotics for the right reason. Make sure you know what you're treating. You're actually treating a bacterial infection. You're not treating a virus. There's nothing worse that you can do is to get a medication that does not treat the condition that you have. And so make sure you fully understand what exactly you're treating and what you're doing to hopefully get you taken care of. Number three, in this scenario, I would recommend starting a probiotic to hopefully give you the gut microbiome improvement or the push that you need. Try a probiotic to help give you the reinforcements that you need to help with your GI tract. Number four, don't make things worse for your gut. So don't add alcohol. Don't add anything artificial sweeteners, processed foods, greasy foods. Eliminate that in the setting of having an antibiotic. And then lastly, number five, prolong your fiber even after you finish your antibiotic for a couple of days. That fiber, once again, you want to add as much fiber as you can to change the foundation of your gut to get you feeling better and to improve your gut microbiome. So there will be a scenario when you have to take an antibiotic. Use these 5 tips to hopefully get you feeling better and to improve your GI tract. Let me know in the comments down below what you guys think or what other tips you'd recommend to hopefully improve your gut microbiome when you take antibiotics. Great question. I hope that helps out, Rochelle. Perfect. Oh, dewormers. All right, great question. So this question is, what about the dewormers that you see all the time on Facebook or Instagram? Well, let me tell you. Easy answer. They're full of it. There's nothing you need to deworm. All right, let's talk about the bigger issue, which is, Dr. Islam, I think I have a parasite. oh my goodness, do I need to deworm myself? What do I need to do? I actually see this quite often. In fact, I've had patients come to see me who say, hey, I got this test done, this stool test which showed I have parasites everywhere inside my gut. I had no idea. What is going on? All right, let's get the story straight. So there are certain conditions in which you will get a parasite. So you travel to a third world country, maybe you don't get the necessary shots that you need, or maybe you're in a farm in which are full of parasites. That's fine. There are real scenarios which you can have this. So when do I suspect you may have a parasite? So we can check your blood count. We can see what are called eosinophils. These are allergic cells that typically go higher whenever you have a parasite. That's one of the first clues that I see that made me think, that's kind of weird. What is going on? Number 2, do you actually have GI issues? So for example, do you have all of a sudden you have diarrhea? Do you have blood in your stool? Do you have weight loss? Do you have abdominal pain? When you have a parasite, it typically will attack your gut, attack your GI tract, and should manifest as acute symptoms. Keep in mind, these are not chronic symptoms you've had for months or years. These are new onset acute symptoms. Number 3, we will go ahead and check stool testing to see if you have those parasites. Now, sometimes we need multiple tests to see what's going on, and we can check that, and that will give us a clue that, all right, this is what's going on. And then lastly, number 4, we may want to consider taking a look with the colonoscopy to see if I can see the parasite or the worm. Now, trust me, I have seen worms on a colonoscopy. Yes, I have. Let me know in the comments down below if you want me to go through a video of the craziest things I've seen on a colonoscopy. But yes, it's true. But there are very specific scenarios in which we may be worried about a parasite or a worm. The scenario which we're never worried about is I see this on the stool testing that I got because of something I had to pay for, and I don't have any symptoms, because that usually is just a waste of time and your money. And keep in mind, don't ever buy a deworming kit or anti-parasite kit unless you actually have a diagnosis of a parasite. Don't try and treat yourself before you have anything, because there are things that you can do that actually can cause harm. I've had a number of patients that buy these things, they wasted thousands of dollars, and they actually took things that made things worse for them to cause them to have significant issues. Just keep that in mind. And always make sure you speak to a healthcare provider. All right. All right, we had 33 likes. Oh, love that. Thank you. Let's get more, guys. Let's aim for 50. If you're joining for the first time, my name is Dr. Islam, and yes, I am your Poop Guru. Every Monday I go live to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to come see us at Gastro for all your GI needs. And also, don't forget to subscribe to this channel as well. All right, next question. Diarrhea. Cha. Dr. Islam, what are natural treatments for diarrhea? Now, we all get diarrhea. Even yours truly, your poop guru, occasionally will get that diarrhea. And I feel like, oh my gosh, what do I do? I need to figure this out. So let me tell you what I recommend to hopefully get things taken care of when it comes... Oh, hold on a second, sorry. Let me just get this taken care of. Sorry about that. All right, so let me just send this message really quick. So what do I do to make sure that my diarrhea is taken care of? Sorry, this is my daughter. So, a couple things that you can do. So, once again, what can you do to get your diarrhea taken care of naturally? So tip number 1, always make sure to hydrate yourself. So it's more important than just to have water. You can have some sort of electrolytes, whether it's Pedialyte or things like this. So make sure you have the electrolytes to give you the fluid that you need to make sure you're not being dehydrated from what is going on. Number 2, the BRAT diet actually works. So bananas, rice, toast. Bananas, rice, and toast. These things actually do work. They have evidence, and we recommend this to help out when it comes to your diarrhea and to get things resolved as well. Number 3, we want to find out the cause for the diarrhea. See, if you have a bacterial infection, we may want to give you an antibacterial medication, or sometimes we will give you anti-diarrheal medications to get you taken care of as well. Number 4, try to add in as much fiber as you can. So fiber will bulk up the stool, to hopefully prevent it from slowing down. One of the best things I recommend is bananas, because bananas also act as an electrolyte. It can also help soften the stools and keep your stools from becoming more mushy and having a lot more consistency with that as well. And then sometimes having some sort of probiotic, whether it's yogurt or kefir, or sometimes even a probiotic supplement, can help out. Now, keep in mind, there are things that you should be aware of in which you need to see medical attention. Number one, if you have diarrhea greater than 3 or 4 days, this is something we need to find out what's going on. If the diarrhea ever wakes you up in the middle of the night, this is not normal. If you have significant abdominal pain, this is not normal. If you have significant abdominal pain, this is not normal. If you have blood in the stool, you should not have blood in the stool. It doesn't matter how much diarrhea you're having, you should never have blood in the stool. And then lastly, weight loss. Weight loss is not typical whenever you're having acute diarrhea. So if you have these, this is not a comprehensive list, but this is some of the things you should be aware of when it comes to diarrhea. If you have this, make sure you see a GI doctor like yours truly to find out exactly what's going on, because this could be a sign of something else going on inside your GI tract. All right. Great question, guys. Perfect. So Rochelle asks, other foods that are stool softeners. One of the best, great question. So we know that there are certain foods that can soften the stool, make things easier. So magnesium-rich foods really can soften your stool. So one of the things I recommend is that. Number 2 are kiwis. Kiwis are a fantastic way to soften your stools. It has fiber, has vitamins, has minerals to help make things easier to pass through. Number 3, bananas, like I mentioned before in other videos, can help soften your stools to make it easier for things to pass. Lastly, we can also have things like plums and prunes, which are very effective. They taste good. They have natural fibers and sugars to soften your stools to make it easier to pass through as well. They work effectively, and they're fantastic when it comes to your gut microbiome as well. All right, guys. Perfect. Well, I am Christina. Thank you for coming. You're not late. I was late, so thank you for coming. I appreciate you watching on the live stream. All right, guys. Perfect. Well, great. I had a great time today. I want to thank you guys for joining me on my POOPSCOOP Monday. So next week, let me try and see my schedule because it is Thanksgiving. I do want to give you guys some tips before Thanksgiving. As always, I want to thank you for watching. I appreciate you guys. I'd love to hear comments on your recommendations of what I can do better. We want to make this into a bigger audience. My poop gurus, my poopettes and poopers. Thank you for watching. I look forward to seeing you guys. I appreciate you guys. Come see us, Love a Gastro, for all your GI needs. And we'll see you hopefully next Monday. Thanks, guys, and take care.